Hello, and welcome to the To Your Health podcast. I'm your host, Rhonda Alfred, and joining us on this episode is board certified neurologist Dr. Tiffany Eady. Welcome to the show, Dr. Eady.
Hi, Rhonda. I'm glad to be here.
Well, we're so glad you could take time out of your busy schedule to join us and be with us today. Tell us a little bit more about yourself and your role at Terrebonne General.
So, I'm a neurologist, which means I study the brain, spinal cord, peripheral nerves. I have extra training in seizure disorders. So, I'm a seizure doctor, which means I study epilepsy, or I'm an epileptologist. And
Fancy.
that actually has several different components. So, my job is to talk to patients who have episodes that they can't control. It can be episodes where they lose awareness. It can be episodes where they have abnormal body movements and they don't lose awareness. It can be sudden drops where they just drop and collapse out. It's my job to figure out why it's happening, what's causing it, and what are we going to do to make it stop. And so, in order to do that, I have a lot of experience and interaction with patients because we kind of go through exactly what's happening. We get a lot of history, but then I'm able to use the EEG to read their brain waves during these events to better understand and categorize them.
Okay, very detailed description of what you're doing. And we're going to dive into today's conversation and learn a little bit more about understanding epilepsy from awareness to action. So, the first question I'm going to ask is, what is epilepsy and how does it affect the brain?
So, epilepsy is when you have too many neurons. So, neurons are the cell of the brain. When there's too many of them working together at the same time. So, hypersynchronous hyperactivity. And so, neurons in the brain, their whole job is to communicate, and they communicate in a very specific way. Well, in epilepsy, you can have a whole area of neurons activate together. And when that happens, it creates too much activity, too much communication, which then can go uncontrolled and spread across the brain. And when it spreads across the brain, as you might imagine, the brain can't do its normal functions like be aware or talk or move, and it can cause a very disruptive episode.
How common is epilepsy and who can it affect?
So epilepsy is very common. Well, so seizures are actually very common. 1 in 10 people will have a seizure in their lifetime. And if you think about that,
Mm.
if you go to a concert or a big sporting event and you look around, 1/10 of those people will have a seizure in their life. Epilepsy is when you have a seizure without a reason to have it. So somebody may have a seizure if they have multi-organ failure, or if they have a head trauma, or if some kind of insult or injury happens to them. The body, when you push it too hard, can have a seizure. In people with epilepsy, the seizures can come out without a good cause, without a new injury or a new accident. And that is about around 2 to 3% of people have epilepsy across the world.
So, what are some common misconceptions about epilepsy?
So, I think that one of the biggest misconceptions about epilepsy is that it is a terrible diagnosis and
Mm.
it means the end of who you are as a person and the end of all your hopes and dreams that maybe you had for yourself, you had for your spouse, you had for your child. And I would say that that's the biggest misconception. We can take 50% of people with epilepsy, give them a reasonable dose of one medication, and make these episodes go away. So, one of my greatest joys in my job actually is to have a patient come to me and say, "Oh my gosh, this is happening. What's
Mm.
going on?" Be so upset, work with them. We do a lot of education, we try all the right medications, and then they stabilize out and they get to start driving again and they get to go to that job and then they bring their new partner and then I hear about the wedding and I hear about the babies. So I would say that as long as it is acknowledged and we work together, life can be beautiful with epilepsy.
So it can be controlled and
100%.
maintained.
Yes.
That is good to know. Why is Epilepsy Awareness Month so important to you as a neurologist?
Well, I think that, like you said, patients with epilepsy have been historically underserved, and there have
Mhm.
been biases associated with that diagnosis. Hundreds of years ago, women with epilepsy weren't allowed to procreate, weren't allowed to marry. People with epilepsy weren't allowed to have jobs, weren't allowed to be
Mm.
part of society. And with things like Epilepsy Awareness Month, when we can communicate that it is a condition that can be controlled, that it happens for a reason that is physiologic. It is a signaling problem in the brain that, if taken the right steps, can be controlled, then people are more comfortable with it. And there isn't that fear that is associated both with the patient, but the people that love the patient, and then potential employers, society, general rules. I think we need to learn about this condition so that people with it, and it is common, can have successful lives in our society.
So, what treatment options are available for people suffering with epilepsy?
Yeah, so I would say that first we have to figure out what exactly is causing it. When it comes to episodes of decreased responsiveness with abnormal movements, there are several different causes that we need to investigate. Once we can figure out what exactly is causing these events, we can dive further into what do we need to do to make them stop. When it comes to epilepsy, 1/3 of patients actually have it for a genetic reason. Now, this doesn't necessarily mean that mom and dad had it. You can have a genetic issue and be the first in your family with a genetic issue. It's a protein malformation or malfolding. And in those patients, they have a certain type of seizure and they have a certain type of syndrome that is best treated by certain medications. Other people, the other 2/3, have seizures that start in one area of the brain and then spread. And this can happen for a variety of reasons. You can have an injury, you can have something happen during development, and it causes abnormal signaling. And then that can turn into seizures. So we start with medications, and we actually now have quite a few medications. I probably have 30 approximately that I can use. There's not one that's way better than another, but they do have side effect profiles that go with them. And so we try one by one until we can get the right combination. For most patients with epilepsy, the right combination of medications and lifestyle changes, such as making sure to get good sleep and
Mhm.
taking it easy when you're not feeling well, when you're sick, treating infections, avoiding fevers. These things can prevent seizures, breakthrough seizures, despite the medications. And then in about 1/3 of patients, we are going to encounter seizures even if we do try many different medications at therapeutic doses. And in those patients, we start looking at procedures and surgeries that can help.
So, there's lots of options available for patients. Just wondering, do all patients who have epilepsy have seizures?
I would say that you can carry the diagnosis of epilepsy and have your seizures controlled. So just because you have a diagnosis of epilepsy doesn't mean that you're having uncontrolled seizures, um, and that, they may occur at any time. I think that that we can get them controlled. However, we do, it's one thing to think that if we push any person hard enough, if you are sick enough, if you are injured in a certain way, any person can have a seizure, anyone. And
Mhm.
so people with epilepsy just have a lower threshold to have those seizures come out. And so if we can work together to raise that threshold so they're not able to develop and they're not able to be produced, then yes, you hold the diagnosis of epilepsy, but you're not having seizures disrupt your life.
What would you tell someone who was recently diagnosed with epilepsy?
There are a couple things that are important. One, I would say, is every time your brain has a seizure, it kind of learns how to have that seizure. So every seizure you have makes it harder for us to stop the next one. So we need to acknowledge this condition and accept it and
Mhm.
work together instead of denying it and thinking, well, maybe it just won't happen the next time. The second thing is when it comes to seizures, they can cause pretty devastating injury and even death. And so we have to be very, very mindful. No swimming alone, right? If your seizures are uncontrolled, no driving because you could hurt yourself and you
Mhm.
could hurt someone else. There are also behavioral things that you can do to help prevent seizures. One is, again, I can't overstate how important sleep is. Having a sleep schedule and sticking to it is very important. Taking your medications is very important. And one, just knowing that if you are if we can accept it and accept the diagnosis and work to make changes to stop the seizures, there is life on the other side of this diagnosis.
And how can friends and family members assist someone who does have epilepsy?
I think being present is the most important thing. Patients who are going through this often feel isolated. They feel like a burden. They feel like they are somehow taking advantage of the people around them. So just calling in, checking, being available, letting them know that it's not a burden, that you want to be there with them, that it's something that you're comfortable with, it's not scary. And then in patients who are just getting diagnosed, one of the main limitations is driving. While we are working to getting your seizures under control, you can't drive. And so if you are someone who is caring about someone with a seizure disorder that isn't quite controlled, offering to give them rides, offering to arrange ride shares, offering to get groceries, offering to take the kids to school is a huge way to relieve stress from some of our patients.
So, how can someone schedule an appointment with you?
We are neurology at Terrebonne, and you just go ahead and give us a call and say, hey, I think I'm having events that are concerning for seizures, and they'll get you hooked up into the clinic.
All right, we have the number right there on the screen for them.
Fantastic.
Thanks so much, Dr. Eady, for sharing this helpful information. We appreciate it.
Thank you for having me.
For more information about neurology care at Terrebonne General Health System, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for joining us.